Depression has long been considered a single disorder, something that looks and feels the same in everyone who experiences it. For decades, this belief shaped how society, medicine, and even psychology understood and treated it. People who felt persistently sad or hopeless were simply categorized as depressed, and the usual prescription involved antidepressant medications or standardized therapy. But as research into the human brain has advanced, this traditional view has begun to crumble. Scientists have discovered that depression is not a one-size-fits-all condition. It is a complex, multifaceted experience that manifests differently in different individuals. What might cause deep despair and lethargy in one person could lead to agitation and anxiety in another. The idea that one label and one treatment could apply to every case of depression no longer fits with what we now know about the brain. Modern brain imaging studies have been instrumental in reshaping our understanding of depression. Through technologies like SPECT and fMRI scans, researchers have been able to observe how various regions of the brain behave in people suffering from depressive symptoms. These scans reveal clear variations in brain activity among individuals who all carry the same diagnosis. For example, some people with depression show decreased activity in the frontal lobes, which are responsible for motivation, decision-making, and emotional regulation. Others show overactivity in the limbic system, the brain's emotional center, and the basal ganglia, which are linked to anxiety and tension. These differences indicate that depression is not a single disorder with one underlying cause, but rather a collection of related conditions rooted in different brain patterns and biochemical imbalances. This understanding is crucial because it explains why some people respond well to antidepressants while others do not. When doctors treat every form of depression in the same way, they are essentially applying a uniform solution to a highly individualized problem. Some patients feel better after taking a standard medication, but others may experience no improvement or even feel worse. Similarly, while talk therapy or cognitive behavioral therapy can be life-changing for certain people, it might not be effective for those whose depression stems more from neurological or biological causes than from thought patterns. This mismatch between treatment and brain type can lead to frustration, stigma, and a sense of failure among patients who are told that they should be getting better but are not. Recognizing that depression is not one-size-fits-all opens the door to more personalized approaches to mental health care. Instead of treating the diagnosis, clinicians can begin to treat the individual. This means assessing each person's unique combination of symptoms, brain activity, and personal history to determine the most suitable plan for them. For instance, someone with low frontal lobe activity may benefit from strategies that boost motivation and brain stimulation, while someone with limbic overactivity might need calming therapies that reduce emotional intensity. Lifestyle factors like sleep, nutrition, and exercise can also be tailored to match a person's specific neurological needs. Beyond treatment, this new perspective changes the way we view those living with depression. It reminds us that mental health conditions are not simply matters of willpower or attitude. They are deeply tied to how the brain functions, and the differences in brain chemistry, wiring, and response are as real as differences in physical health conditions like diabetes or asthma. When we accept that there are many forms of depression, we move closer to compassion and understanding rather than judgment. We stop blaming people for not recovering fast enough or for not responding to a particular therapy. Instead, we begin to see that each brain has its own story, its own struggles, and its own path to healing. Recognizing this complexity is the first step toward a future where mental health care is truly personalized, where every individual receives the kind of support that aligns with their unique brain and life experience. The human brain is one of the most intricate and powerful organs in existence, responsible for every thought, emotion, and behavior we experience. When it comes to depression, the brain holds many of the answers to why people feel the way they do. For years, depression was understood mainly through the lens of psychology, focusing on emotions, environment, or past experiences. While these factors are certainly important, advances in neuroscience have revealed that depression is not just an emotional or situational issue, it is also deeply biological. The way the brain functions, the regions that activate or shut down, and the balance of neurotransmitters all play a critical role in shaping a person's mental state. Understanding these brain-based clues gives us a clearer picture of why depression can look so different from one person to another and why personalized approaches to treatment are essential. Brain imaging technologies such as functional MRI, fMRI, and SPECT scans have revolutionized our understanding of mental health. These tools allow scientists to observe how blood flow, electrical activity, and metabolism change in various regions of the brain during depressive episodes. One of the key findings is that depression is not associated with a single pattern of brain activity. Instead, different people exhibit distinct neurological signatures. Some individuals show reduced activity in the prefrontal cortex, the area of the brain responsible for focused decision-making and emotional control. This can lead to symptoms such as apathy, lack of motivation, and difficulty concentrating. Others show increased activity in the limbic system, which governs emotional responses, leading to overwhelming sadness, emotional sensitivity, or a tendency to dwell on negative thoughts. These differences show that depression cannot be defined by one set of symptoms or one biological cause. Another area that has drawn attention in research is the basal ganglia, a structure deep within the brain that regulates movement, motivation, and anxiety. Overactivity in this area has been linked to the form of depression that comes with high levels of tension and restlessness. People with this pattern often experience racing thoughts, irritability, or physical symptoms like muscle tightness. Meanwhile, the anterior cingulate gyrus, another important brain region, can become overactive in individuals who struggle with obsessive thinking or who can't seem to let go of guilt or worry. Each of these patterns tells a different story about what is happening inside the brain and helps explain why depression manifests in so many forms. Recognizing these neurological differences also helps us understand why treatments can vary so much in their effectiveness. If someone's depression stems primarily from low frontal lobe activity, they may benefit from interventions that boost stimulation and motivation, such as certain antidepressants, behavioral activation, or brain-based therapies. Conversely, if another person's depression is linked to an overactive limbic system, calming therapies, mindfulness, or even mood stabilizers might be more helpful. This science-driven understanding moves mental health care beyond guessing and into precision medicine, where treatment can be tailored to an individual's specific brain activity. Beyond the clinical implications, these discoveries carry a powerful message for society. For a long time, people with depression were made to feel like their suffering was invisible or their fault, as if they could simply snap out of it. Brain research shatters that myth by providing visible, measurable evidence of the changes that occur during depression. It shows that depression is not a weakness, but a condition with identifiable neurological foundations. This shift from judgment to understanding can foster greater compassion and reduce stigma. Ultimately, the brain does not lie. It reflects the true biological basis of what a person is experiencing. By studying it, we gain the tools to see depression not as a single mysterious shadow, but as a spectrum of brain-based imbalances, each requiring its own approach to healing. Understanding how different brain regions contribute to mood, thought, and behavior allows doctors, therapists, and patients to work together in a more informed, effective, and hopeful way when people talk about depression. They often imagine it as one general condition that makes a person feel sad, tired, or hopeless. However, neuroscience has shown that there are several distinct patterns of brain activity that lead to different forms of depression. These patterns are sometimes referred to as the 5 brain types of depression. Each type is linked to a unique combination of biological, emotional, and behavioral symptoms, which means that every person's experience with depression can be very different. Understanding these 5 types helps explain why a treatment that works for one individual may not work for another, and why a deeper look into how the brain functions is necessary for truly effective care. The first type is known as pure depression. This form is often associated with reduced activity in the prefrontal cortex and other regions of the brain that control mood, motivation, and decision-making. People with this type usually feel a persistent sense of sadness, lack of pleasure in activities, low energy, and difficulty concentrating. Their emotional state tends to remain flat, and they may withdraw from social interactions or responsibilities. This is the most classic and widely recognized form of depression, and it often responds well to traditional antidepressant medications and cognitive behavioral therapy, which aim to balance brain chemistry and restore positive thinking patterns. The second type is depression with anxiety. This type combines the symptoms of sadness and hopelessness with excessive worry, fear, and tension. Brain scans show increased activity in the basal ganglia, a structure involved in regulating anxiety and stress responses. Individuals with this pattern often feel restless, overthink situations, and may experience physical symptoms such as muscle tightness or headaches. Techniques such as mindfulness, relaxation exercises, or specific medications that target both serotonin and GABA levels tend to be more effective than standard antidepressants alone. The third type, temporal lobe depression, is associated with irregular activity in the temporal lobes, which are crucial for memory, emotional stability, and understanding language. When this part of the brain does not function properly, people may experience mood swings, irritability, anger outbursts, or even difficulty recalling details. Some individuals also report heightened sensitivity or paranoia. Traditional antidepressants might not always help this type. Instead, treatments that stabilize mood and improve brain function, such as anti-seizure medications or targeted psychotherapy, often work better. The fourth type is called overfocused depression. This pattern is marked by overactivity in the anterior cingulate gyrus, an area responsible for shifting attention and flexibility of thought. People with this type tend to get stuck on negative thoughts, past mistakes, or worries. They struggle to move on from disappointments and can appear rigid or perfectionistic. Because their brains are essentially locked in repetitive cycles of self-criticism, they may respond best to therapies that help them build cognitive flexibility. Treatments that boost both serotonin and dopamine, along with techniques like mindfulness or acceptance-based therapy, can help break the cycle of overthinking. The fifth and final type is limbic depression, linked to overactivity in the limbic system, the brain's emotional center. Individuals with this type often feel deeply sad, emotionally sensitive, and easily overwhelmed by small stressors. They might cry frequently, feel isolated, or find it hard to experience joy even in positive situations. This form of depression benefits from treatments that activate emotional connection and bonding, such as group therapy, regular exercise, and activities that release oxytocin and endorphins. These 5 brain types highlight that depression is not one uniform illness, but a collection of brain-based conditions with unique causes and manifestations. By identifying which brain circuits are involved, clinicians can personalize treatment instead of relying on a single generalized approach. This understanding gives hope to millions who have not responded to standard therapies, showing that with the right diagnosis and treatment for their brain type, improvement is truly possible. For many years, the treatment of depression followed a general formula. When a person was diagnosed, they were often prescribed a standard antidepressant or recommended for a traditional form of therapy. This approach was based on the assumption that depression was essentially the same for everyone and could be treated with similar methods. However, as research into brain function and individual biology has advanced, it has become clear that this one-size-fits-all strategy does not always work. In fact, it often leaves patients feeling frustrated when treatments that help others seem to have no effect on them. The truth is that depression varies greatly from one person to another because it arises from different brain patterns, genetic influences, and environmental experiences. The idea of personalized treatment recognizes these differences and seeks to match therapies to each individual's unique needs. Personalized treatment starts with understanding that no two brains are identical. Brain imaging studies have shown that people with depression can have very different neurological signatures. Some may have underactive frontal lobes, which affects motivation and decision-making, while others may have overactive limbic systems that cause emotional overwhelm and sensitivity. Still others may show excessive activity in areas linked to anxiety or obsessive thinking. When these distinctions are ignored, treatment becomes a matter of trial and error. But when doctors can identify a person's specific brain type, they can choose interventions that directly target the areas of dysfunction. This approach not only improves outcomes, but also reduces the emotional toll of failed treatment attempts. In personalized care, medication is selected based on the patient's individual chemistry and brain function, not simply by general diagnosis. For instance, someone with anxiety-related depression might benefit more from medications that calm overactive neural circuits, while another person with low brain activity might need stimulating compounds. Similarly, lifestyle and behavioral recommendations are tailored to the person's unique situation. A patient with low motivation might need structured routines and high-energy activities to re-engage brain circuits, while someone prone to emotional overstimulation could benefit from mindfulness, grounding techniques, and a calmer environment. Therapy, too, becomes more effective when it is adapted to the individual. Cognitive behavioral therapy may work well for someone who struggles with distorted thought patterns, but a person whose depression stems from trauma or emotional dysregulation may find more relief in approaches like eye movement desensitization and reprocessing behavior or dialectical behavior. Therapy DBT. Some people might respond best to brain-based interventions like neurofeedback, transcranial magnetic stimulation, TMS, or light therapy. Personalized treatment means using every available tool to match the therapy to the brain, rather than trying to force the brain to fit the therapy. The move toward personalized treatment also has an emotional and social dimension. When patients realize that their struggles are not due to weakness or lack of effort, but to measurable differences in brain function, it can bring immense relief. It reframes depression from being a personal failure into a medical and biological challenge that can be addressed scientifically. This change in perspective fosters greater compassion both within the individual and from society at large. Instead of asking why someone is not responding to treatment, clinicians and loved ones can begin to ask what kind of treatment is right for that specific person. Moreover, personalized treatment empowers individuals to take a more active role in their own healing. Through genetic testing, brain imaging, and thorough psychological assessment, patients can learn more about how their minds work and what interventions are most likely to help them. This collaboration between patient and provider creates a sense of partnership and control that is often missing in traditional mental health care. The future of treating depression lies in precision medicine, where each person receives a plan based on their own biology, psychology, and lifestyle rather than a generalized protocol. This approach respects the complexity of the human brain and acknowledges that true recovery happens when treatment is as unique as the person receiving it. Depression is often described in scientific terms: chemical imbalances, brain circuitry, neurotransmitters, but behind all the biology lies something deeply human. The way we respond to depression, both as individuals and as a society, cannot rely on science alone. Compassion is equally essential. When we blend compassion with scientific understanding, we move closer to the kind of healing that respects both the mind and the heart. Compassion reminds us that depression is not a character flaw or a sign of weakness. It is a complex condition that affects the brain, emotions, and body. Science provides the tools to understand it, but compassion gives meaning and empathy to the process of recovery. Together, they create a more complete and humane approach to mental health. For decades, people suffering from depression have faced not only the weight of their own emotions, but also the burden of misunderstanding and judgment from others. Society often sends messages that reinforce shame, such as a just cheer up or a try to think positive. These responses, while often well-intentioned, overlook the biological roots of depression. When someone's brain chemistry is altered, or when specific regions of their brain are underactive or overactive, willpower alone cannot correct it. This is where science helps by showing visible, measurable evidence that depression is real, not imagined. Brain imaging has revealed that different types of depression correspond to different patterns of brain activity. This knowledge validates what many people have always known intuitively, that their pain is not just emotional, but physical and neurological as well. However, science without compassion can be cold and incomplete. Even when we understand the brain mechanisms behind depression, healing still requires connection, empathy, and understanding. Compassion bridges the gap between medical treatment and human experience. It involves listening without judgment, offering emotional support, and treating each person as more than their diagnosis. When a doctor or therapist approaches a patient with genuine care rather than clinical detachment, it can make a profound difference in how that person feels about their recovery. Research even shows that patients who feel understood and supported are more likely to respond positively to treatment. Compassion, then, is not just a moral virtue. It has tangible healing power. Combining compassion with science also helps reduce the stigma that still surrounds mental illness. When people see depression explained through both neuroscience and empathy, it becomes easier to talk about and easier to treat. Understanding that the brain is involved does not mean that a person's emotions or life experiences are irrelevant. On the contrary, compassion helps integrate the two perspectives. It allows for treatments that acknowledge both the biological and emotional dimensions of suffering. For example, while medication may help balance brain chemistry, supportive relationships and therapy provide the warmth, connection, and understanding that restore a sense of belonging. In many ways, compassion is what transforms treatment into healing. Medicine can stabilize symptoms, but compassion helps rebuild confidence and hope. It reminds people that they are not defined by their illness and that recovery is possible even after long struggles. When family members, friends, and professionals practice compassion, they create an environment where healing can truly occur. This is why mental health care must go beyond prescriptions and protocols. The most effective approach combines scientific precision with human kindness. Ultimately, the goal of merging compassion and science is to see the whole person, not just the illness. Depression affects how people think, feel, and relate to the world, and those layers cannot be healed by science alone. Compassion gives individuals the strength to keep going, while science provides the tools to understand and treat the condition. When these two forces work together, they create a model of care that honors both the complexity of the brain and the dignity of the human spirit. The way we understand and treat depression is evolving, and this evolution represents a new vision for mental health. For many years, the approach to depression was narrow, focusing mainly on symptom reduction rather than understanding the deeper mechanisms behind it. People were often given standardized treatments without much consideration for individual differences in brain function, personality, or life experiences. However, the discovery that there are multiple brain types of depression has opened the door to a more hopeful and effective future. This new vision emphasizes precision, empathy, and personalization. It recognizes that mental health care must move away from the traditional one-size-fits-all model and instead embrace an approach that honors the uniqueness of every individual. The foundation of this vision lies in scientific progress. Brain imaging technologies such as SPECT and fMRI scans have shown that depression affects people in different ways at the neurological level. Some individuals may have decreased activity in areas responsible for motivation and focus, while others may have excessive activity in emotional regions that amplify sadness and anxiety. These discoveries have proven that depression is not a single disorder, but a group of conditions that share similar symptoms yet have different root causes. This knowledge allows doctors and researchers to develop targeted interventions that treat specific brain imbalances rather than merely addressing surface-level emotions. The result is a shift from trial and error treatment to a more precise and informed strategy. In this new vision for mental health, the goal is not only to reduce symptoms, but to help people achieve long-term recovery and resilience. That means going beyond medication and therapy alone. Personalized care integrates multiple aspects of a person's life, including physical health, nutrition, sleep patterns, and social connections. Research shows that lifestyle factors can significantly influence brain chemistry and emotional well-being. For instance, regular exercise increases serotonin and dopamine, healthy diets support brain function, and quality sleep restores emotional balance. A holistic approach that combines neuroscience with daily life practices can create a more sustainable path to healing. Technology also plays a key role in this transformation. With advances in brain mapping, genetic testing, and digital mental health tools, professionals can now collect and analyze data to tailor treatments more accurately. Apps that track mood patterns, sleep cycles, and stress responses can help identify what triggers depressive episodes and what interventions work best for each person. Artificial intelligence and data science may soon allow therapists to design individualized care plans based on a person's biological and psychological profile. This merging of technology and compassion ensures that care becomes more proactive, not just reactive. Another essential part of this vision is breaking down stigma. By understanding that depression is linked to measurable changes in the brain, society can shift from seeing it as a weakness to recognizing it as a legitimate medical condition. Education and awareness campaigns can empower people to seek help early rather than waiting until their condition becomes severe. Compassionate dialogue around mental health can normalize treatment and create environments, home, at work, and in schools, where emotional well-being is supported rather than hidden. The future of mental health also calls for collaboration between different fields. Psychiatrists, psychologists, neurologists, nutritionists, and even fitness experts must work together to address the multiple dimensions of depression. A truly new vision means seeing the person as a whole system, not a collection of symptoms. It involves combining evidence-based medicine with empathy, community support, and personal empowerment. In doing so, treatment becomes not only about healing the brain, but also about helping people rediscover purpose, connection, and joy in their lives. This approach represents a turning point in how we view depression and mental health as a whole. It's a shift from uniformity to individuality, from stigma to understanding, and from temporary relief to lasting well-being. By embracing science, compassion, and personalization, we can move toward a world where mental health care is not just about treating illness, but about nurturing human potential.